So here we go again. Here we go again. How many times do the voters, do the citizens, do the seniors of this state have to get rolled in order for the nursing home lobby to extract every single last penny out of the hide of the people of this state? Well, you know, we've talked about this many times before, and then I saw the article by Dan Fagan. Every once in a while we talk to Dan because every once in a while we see a great article that he's done that absolutely encapsulates the frustration, the absolute utter ridiculousness of the stranglehold the nursing home lobby has on the state of Louisiana. Dan Fagan, welcome to the Ross Report.
Well, thank you, Carol. It's good to be here.
I tell you what, we've had shows on this topic before, and when I read your article and I thought, Dan puts it so eloquently and so succinctly, how much more do the people have to come up with to at least get a fair shot for the home health care people? They're just not getting a shot at this at all. This bill was killed in committee, in the Senate committee, right?
Yeah, it never made it out of committee. Really never had a chance. You know, when I was writing the column, to be honest with you, I was thinking about my father, who died about 9 years ago, died on Easter Sunday. And he had cancer at the end of his life, and he went through a rough spell there for a few months. But he was home. You know, we cared for him. My mother was there. I was there. My sisters were there. And he died in his home. And he used to tell me, you know, prior to all this, back, 10, 15 years ago, he said, whatever happens, don't ever put me in a nursing home. Mm-hmm. That was like his big fear. Mm-hmm. And I know that, I'm not saying that nursing homes are horrific or terrible places, but I know a lot of seniors who really dread the notion of having to leave their home and go into a nursing home.
Well, Dan, nobody is putting a cut on the nursing homes. They do a job that has to be done. In many cases, there's no other way to go. The nursing homes have their place. My problem, yes, and I know your problem, is the home health people the seniors and the taxpayers of this state are paying for the greed of the nursing home lobby. I'm sorry, there's no way to put it. I've seen it. I served on the board of lobby for over 20 years, and every time, way back when, I got off about 6 years ago. So you tell how long that was. Every single time someone tried to reform the reimbursement formula for nursing homes, it got killed immediately, and nobody would stand up to them. Nobody.
Yeah, and you look at the pawns in this. It's the seniors who have every right to want to be, and we're talking about a cheaper option, Carol.
Yeah,
it's less expensive. It's not like we're asking taxpayers to pay more so seniors can stay in their home during their final days. It's actually less, and the idea that not only would we deprive seniors of spending their final days in their own homes around their family instead of around a bunch of strangers, we're actually paying more to deprive them of that. I don't understand the legislators and, frankly, governors who would look at this situation and say, if I can get a little more campaign cash, I think I'm going to go ahead and sacrifice these seniors and their option of spending. I'm going to give them the benefit of the doubt and say they haven't thought that through.
Don't. This is unconscionable, and it's happened so many times before, over and over and over again, that this has happened, that they don't even get it out of committee, that they kill it, that they get the nursing homes, as you pointed out. Let's go through some of the numbers. Their rates have risen 54% over the last decade. Yeah, 54%. Right. They get reimbursed to the tune of 77% of the Medicaid budget, 77 to 33. Right. In other states, it's 60-40. It's a little more reasonable.
Right. And it's statutorily mandated to give them a rate increase every year. I mean, they've really got
wait.
Government under control.
You serious? It's statutorily mandated. Wouldn't you love to have a business that the government mandated people to pay you more every year, whether you did the job or not?
Well, let me ask you about that, Carol. So you think that these politicians actually have thought it through and come to the conscious decision that, yeah, I'm willing to deprive an 82-year-old woman or an 83-year-old man of staying in his home and spending his final days there if it means I can get more campaign cash. Do you think they've really thought that through?
Let's go through a little exercise here. Somebody gives you a lot of money, and you turn around and you can rationalize their argument because they're giving you some great arguments, like the home health companies. You know, they have problems, those home health care people. They're not the answer to everything. Well, no, we know they're not the answer to everything. They're not the answer. Now, you know, it's really tough out there, and so we really need your help because we poor nursing homes, you know, you can rationalize anything, Dan. You get what I'm saying? Okay. You can rationalize anything. And I think that's what they're doing.
So they've convinced themselves that what they're not doing is despicable, even though it is.
Well, when they're getting all that money to the bottom line, Jindal got $1 million.
I know. And Edwards has already got over 700,000.
Correct. 720,000. Yeah. So who do you think they're going to listen to when it comes right down to it? And I honestly don't know how we're going to break that stranglehold. You have former legislators. We have a former legislator who owns a nursing home here in Lafayette and has for a long time. And from every account, they do a good job. I have friends who are in the business. I have family members who have stayed in nursing homes and gotten good care, and friends who have. I am not putting down on that. What I am saying is that it is so unfair. It is so skewed one way that it hurts everybody, the seniors, and every survey. You've seen the surveys. People want to stay in their homes.
Well, AARP, and I don't know how credible this is, but they said 90% of the seniors they polled in Louisiana said they would prefer to be at home instead of a nursing home. So.
Well, I guarantee you the people I talk to, that reinforces the people I talk to. I mean, I'm not a huge fan of AARP, never have been, but I think they're right on this one. Yeah.
Well, you know, you asked what will break this stranglehold. Shows like yours, you know, you talking about it, and I know you spend a lot of time on the topic, and that's a good start.
Well, you know, and the problem is it's just like education. You only have a limited number of people who are using that service at any given time. And they don't really get organized, and they don't really push back. And so these guys slide through generation after generation after generation. And here we are still fighting over this all these years later, and they are still getting reimbursed to a really obscene amount. Oh, and by the way, where's the quality of care? Ranked about 49th?
Yeah, it's not good. You know, I think it's very important to point out, too, Carol, that Governor Edwards does not need the legislature for this. He can, within his own authority, redirect some of this money away from the nursing homes into the home health care. So I think this all kind of lands on him at this point, and he needs to really answer for it.
Did he not make that promise that he was?
He campaigned on it, sure. Yeah,
well, I guess
during the campaign.
All right. Let me say this: they could do it through managed care, apparently, because that's what the Jindal administration was getting ready to do before they got the phone call from the nursing home lobby and killed it. And killed it.
Yes.
I mean, that is shocking. It's you know, there's pay to play. We know that, no question about it. And people are more amenable to those who give them a lot of money. I mean, that's just human nature, right? But at some point, Dan, you're right. When do they start really thinking about their constituents, about the seniors in this state, and about a budget crisis?
Right. And, you know, the thing is, I totally agree with you on the fact. Well, I think, what was it, 100,000? It was $100 million a year that Senator Appel said that we would probably save if we went more toward managed care, home health care.
Right.
You know, the thing is, though, I wonder if this is a fair assessment. Most of the legislators, they're pretty well off. Their families are pretty well off, and I think who this really affects is we're talking about, you know, people who maybe are not as well off, who don't have the options that the family members of some of the legislators would have. I don't want to play class warfare here because I'm not about that at all. But I wonder if that has something to do with it. I wonder if some of these legislators who are willing to sell these seniors down the road think, well, my grandmother, my father, my aunt, my uncle, they'll be okay because, you know, they don't really need help when it comes to the end of their lives. Do you think that might play a role in this?
I don't know. I don't understand it. And let me tell you, some people who I really respect sat on that committee, including the chairman whom I like a whole lot, Senator Fred Mills, who has an interest in a nursing home. Of course, he didn't have to vote because the vote was so one-sided. And then our own state senator, Gerald Boudreaux, from Lafayette, parts of Lafayette and St. Landry. And this is a very disturbing thing to me. I have always respected these guys, but I'm telling you, I'm losing respect for a lot of these people. Representative Bob Henskins, another good conservative. He's a nursing home administrator. He was sitting in on the hearing. But Joe McPherson, McPherson says, this is emotional to me. It's disturbing to me. I don't want to have to deal with insurance companies. What? What? Wow. You don't want to have to deal with insurance companies? Now, Wednesday, the Health and Welfare Committee on the House side is set to take up the sort of a companion measure by Prairieville Representative Tony Bacala. And Bacala said he was unsure if he'd pursue the bill because even if he got it passed in the House, it would die the same death if Apple's bill, once it made to the same death as Apple's bill, once it made to the Senate.
Sure.
All right, listen, we have to take a break. Lots more to talk about that. We want to really dig into the numbers and really let people know why this is such a disturbing situation and how it really directly affects all of us because of the enormous, obscene amount of money that we are spending on reimbursing nursing homes to the detriment of home health and to the detriment of people who want to stay in their homes. Dan, hang on. We'll be right back on the Ross Report with Dan Fagan, who wrote an absolutely superb article. Oh, man, I don't know what we're going to do, people. We need your help. We just need to get everybody motivated to understand how this is affecting all of us. We'll be right back on the Ross Report. Hope you will, too. And the number to call if you want to get in on the conversation is 232-1542. Stay with us. All right. Welcome back to the Ross Report on an Easter Monday. We have Dan Fagan on the line with us, wrote a great column about the shameful vote in the Senate committee for nursing homes, supporting the nursing. You know, Dan, you made you put some great numbers in here in terms of how much care in nursing homes costs the state. About $47,000 per resident per year? Yeah. Meanwhile,
and the home health care was ranging from 10,000 to
about 13 to 33. I mean, that's a pretty
13, 33. Yeah,
that's pretty startling. That is pretty startling.
Such a difference. Yeah,
and then go ahead.
It's the preferred method. It's the preferred option of the senior to be cared for in their home, not in a nursing home. And then, as you said in the last segment, Carol, we're not coming down on nursing homes as though they're these evil entities that abuse seniors. We're not saying that. I'm sure there's some wonderful nursing homes out there. But when you have an option that is preferred by the seniors, that's cheaper for the taxpayers, and the only reason it remains as dominant as it does, talking about nursing homes, is because the owners of nursing homes, they formed this cabal, this lobbying group, and they can pretty much have their way with legislators because they throw a bunch of cash around.
I noticed in your article, that was pretty startling, actually. In your article, you said the Advocate reported last year that the industry had pumped more than $6 million into political campaigns over just a decade or so.
Yeah. Isn't that amazing? That's a lot of money.
It is. And the home health people, they don't have that kind of money for sure.
No.
I know that.
No.
Oh, the other thing I thought was interesting is that the week before the vote, they spent about $100,000 on TV ads in Baton Rouge. That's
right.
Oh, geez.
Just singing the praises of nursing homes. Sure.
Yeah. And I misspoke. It's 77-23. 77 to the nursing homes, 23 to home health care. Kenneth.
That's not a Medicaid.
We have a phone call coming in, Dan. Kenneth, go ahead. You're on the Ross Report. Welcome.
I got a little comment about nursing homes. A lot of nursing homes that use subcontractors to build their nursing homes, to remodel their nursing homes, they bond them. So if it's a $16 million project, they'll bond it for $1.6 million. They'll promise the subcontractor he's going to get paid, and he never gets paid. Might get 10% the cost of his job.
Wow.
So I'm just saying they are a lot more greedier than what you're saying just on the radio station. It goes a lot deeper, too.
Well,
and you can lien the project. They're never going to sell it, so you're not going to get paid.
Yikes. You sound like you have definite experience about that.
A few people got screwed, and I almost got screwed, but I lay floors for a living, and they had to have a fire inspection. They needed something done. I wasn't going to give them the job until I got my check in my hand. Went on for like 4 or 5 weeks. I never went back after I got my check in my hand, but the following small-time business, he went in there and just hearsay, he got stuck for $10,000.
Oh, man.
So for a working man, that's a lot of money.
Yes, indeed it is. Working on tight margins, yeah. Thank you, Ken. Thanks for that. I'm sure there are a lot of other side issues to this. The thing that we're most concerned about, Dan Fagan's column, and myself, and a lot of people are concerned about this, that the state is reimbursing these people. And the thing, what gets me, Dan, the testimony in the committee was really interesting, because in most other areas, they kept saying that managed care was too risky and unreliable for the state to take on for seniors. But the vast majority of Louisiana's Medicaid population is already under managed care, and it works pretty darn well.
Yeah, absolutely. It's very double standard.
Right. Apple pointed out, he said, we have a managed care system in Louisiana for 1.3 million people. He says, so we have ample evidence of success of the managed care model. I don't know. Dan, you went to did you go to the meeting, or did you just get the report?
Go.
Okay.
I just read some of the transcripts,
Oh, man. I tell you, the transcripts are really something else.
Yeah.
Something else. And how they can rationalize this with a straight face is really quite beyond me. And again, you and I are both saying nursing homes have their place. We don't want to take anything away from the nursing homes except the outrageous reimbursement that they're getting to the detriment of the home health and also the home health people and the seniors who want to stay in their home. Michael, go ahead. You're on the Ross Report with Dan Fagan.
Thank you so much. Listen, was it Japanese or Chinese said that you can tell the state of a country by the way they take care of their old people? We sure have failed.
Yeah.
Absolutely. And this nursing home is just greedy, is all it is.
Michael, it's just so sad. I mean, we're not saying anything, negative about whether they provide the care or whatever. The problem is they have too much clout. They get too much reimbursement to the detriment of home health and seniors who want to stay in their home, and to the budget of the state of Louisiana. We are going broke on Medicaid reimbursements.
Yeah, and so they spent $600,000 a year on lobbying for 10 years. You said $6 million.
Millions,
for
$6
million.
Yeah, $600,000 a year. Right.
Yeah, it works out to $600,000. That the numbers just don't match what's going on and what's happening here. So, listen, enjoyed it, and thank you, guys.
Well, thanks, Michael.
Thank you.
Yeah, well, Jindal got $1 million himself. John Bell Edwards has gotten $720,000 so far.
Right, so far. Well, Carol, there's nothing new about government wasting money. There's nothing new about government picking winners and losers based on campaign contributions. But the thing that separates this scandal from the other ones is that who gets hurt? The senior. Yeah. To me, that's what raises this to a level that is uncommon with other government waste and government picking winners and losers scandals.
Dan, it is. How do you look these people in the eye and say, no, we don't care about you. You want to stay home? Too bad. Too bad. There's not enough money. People are what did they say? There's a huge waiting list, like 28,000 people on a waiting list.
28,000 people, right, currently wanting home health care over nursing homes, yes.
There you go. Hold on. Charlie, go ahead. You're on the Ross Report. Welcome, Charlie.
Yeah, y'all had a topic that is near and dear to my heart because I'm not too far away from all that. And I know just for a decent nursing home and not these kind of state-run or facilities or whatever, it costs probably about $5,000 or $6,000 a month at a long-term care facility, and getting long-term care insurance, that'll only cover you for about a year if you're lucky on that. And I mean, home health care, it's the way to go. It's probably more efficient than when you're doing that. You can get sitters and stuff. I don't understand because those nursing homes can be even the good ones can be depressing places.
Well, of course. I mean, it's not. You're not dealing with people who are in good health. I mean, usually when they're in a nursing home, they have special needs, et cetera. We don't take that away from the nursing homes. The problem
go ahead. And some of the workers over there, sometimes they treat the old people like little children. Sometimes, and the way they talk to them, I know how old people can be, but look, we're all going to get to that one point in our lives.
Well, I'm not going to say anything about the people who work in nursing homes because I think they work hard, and it's a really difficult job, really difficult. We're not talking about that at all. We're talking about the greedy owners.
I agree with you, and we don't need to be. And those people that didn't get paid, for the work they did, I mean, that's reprehensible. And they need to, we need to worry about the people instead of taking care of some industry that pays you a lot of money. Or buys your loyalty and stuff.
Well, you know what? And the state is in such a dire straits. You think they'd be looking for every possible way to be more efficient with the spending of the state dollars.
But it's not about that, Carol. It's about how much money you get to vote a certain way. I mean, in a perfect world, they want to be efficient, but they're more worried about their own bottom line.
How much is enough? Just let's ask that question. How much is enough to sell the seniors and the state down the river? How much is enough?
Well, people, and you know what? Seniors can get together. They're a very large voting bloc if they just get organized.
Well, that's the problem. That doesn't happen very easily.
Well, no, it doesn't happen. But, amen to what you're talking about today.
Well, thanks.
I caught it on the radio, and it's a great topic for you to be talking about. And, go get them and keep the pressure on Carol and you, sir, because that's just not going to escape any of us. We are all going to be there one day.
One day. You're absolutely right. Let's hope they get it straightened out by then, Charlie. All right.
Yeah, let's hope so, Carol. I know you'll be kicking butt, Carol, so no problem.
All right. Thanks, Charlie. Yeah, Dan wrote such a great article. I mean, we've had several conversations about this. In fact, a CPA friend of ours has really drilled into the Medicaid money. And he said it's simply not sustainable. Now, when they're ready, we've had 6 special sessions under this governor. Does that tell? And nothing has been solved. So does that tell you how absolutely feckless they are at trying to get something substantive done?
Perfect word, feckless. Perfect. I agree. Couldn't agree more.
Well, we have Carrie coming on. Hold on, Dan, because we'll take a break after Carrie. And then we want to drill down into some of this other information that we have and maybe see if Representative Bacalau's bill might have a shot. Carrie, go ahead. You're on the Ross Report with Dan Fagan.
Good afternoon.
Hey.
This is a related topic. It's the attitude of some doctors, not all, but some doctors. I took care of my father's brother who died in my arms at age 93 years old. Oh, wow. But I brought him to a doctor, and after the doctor treated him and the nurse was getting him ready, this doctor came out into the lobby and looked at me very angrily and say, "Why isn't this man in a nursing home?"
Wow.
And I just said, well, because he doesn't want to be. He had his right mind. He knew, I brought him to live with me from New Orleans because he was living by himself and it wasn't a good condition.
Right.
So I had to promise him before he would come with me, because it was his choice. I had to promise him that I would never put him in a nursing home because he was deathly afraid of nursing homes, and I said, I promise you, I'll never do that. That was an oath. And so when this doctor came out and said, "Why isn't this man in a nursing home?" I said, "Because he doesn't want to be."
It's pretty offensive.
Well, my father was the same way. He did not want to go into a nursing home. That was his big thing.
And, I've had family members who have been treated with, taken care of by home health care agencies. And I'm telling you, if most of them were very, very attentive and very helpful, and I've had no problem with the kind of care that they provided. So I know that you do have to stay on top of it. There are some unscrupulous operators for sure, but that goes with any industry. And when we look at the reimbursement rates that the nursing homes are getting as opposed to the home health agencies and the waiting list, there is simply no rationale for this. for what is going on in the legislature right now?
I think that people in nursing homes, they're not happy. They don't want to be there, and so they maybe complain a lot, and they're old. I'm getting old and crotchety. And and the nursing home people, as good as they may be, get frustrated with them.
Well,
because,
sure. It's a very difficult job. I give them all the credit in the world for doing that job. It's not easy.
But home health care kind of comes in, says a nice word, does their job, and they don't have a lot of time to be frustrated with the patients that they're working with.
Right, but go ahead.
And let's be honest, there's just something about waking up every morning in your own home, not having to deal with strangers down the hall, not having to deal with people you don't know.
Another issue, if I could bring it up, Carol, is that the nursing home restricts people what they eat, and they're used to eating certain things. They're used to having their coffee. They're used to fixing their breakfast and what have you. And in a nursing home, my father had to go into a nursing home, but that was his choice. They said, well, you have diabetes, so you can't have anything with sugar. You have high cholesterol, so we restricted him. Well, he died at 100 years old, but
bless his heart.
I don't think that's what killed him. The idea was, in his last days, he wasn't able to enjoy the things. He liked to get up in the morning and fix his coffee, and I think it takes it away from, because they saw you got to follow these rules and these diets and what have you.
Well, fundamentally, it's a loss of control. And bottom line, it's a loss of control of your life.
Yes.
And I think that's what most people fear most.
Right.
I think so.
Carrie, thanks for the call, my friend. Thank you for calling.
Thank you all. You're doing a great job.
Thank you. We're going to take one more break. Dan, if you can hang around just for one more segment, we'd appreciate it. Okay, good deal. We'll be back on the Ross Report, 232-1542. If you want to get in on the Delta World Tire Hotline, we got a line for you. All right. You're on the Ross Report with Dan Fagan talking about nursing homes. Scott, go ahead. You're on the Ross Report. Welcome. Hey, Scott. Hello, Scott. I'm not hearing him. Hey, Scott, go ahead.
Are you there?
Yeah.
Are you there?
Yeah. Mm-hmm. Go ahead.
I'm really glad that you guys are covering this today. This is a very sore topic for me. I'm kind of new here to Louisiana, but I lived for many years in Arkansas, where I was a social worker for several of those years. I started off in adolescent, in at-risk children and things like that. And I started dating a social worker who was a social worker in a nursing home. Mm-hmm. And I became engaged to her. And so I was very good at it. And I'm not trying to pat myself on my back. I was very good at what I was doing with the counseling with the kids and stuff. So she thought that I would be a good fit with a nursing home. So there was an opening at a local nursing home, and I went and interviewed for it and got the job. And it wasn't long, probably 3 or 4 months down the road, where I just started seeing things that really began troubling me. Now, a social director in a nursing home, a social director's job is to be the advocate for the resident.
Right.
Okay, above all else.
Right.
So I started seeing things that really began troubling me. For instance, when a resident comes into a nursing home, if they're on Medicare will pay for the first 100 days of their residency. After which, they have to either be on Medicaid, or they have to come up with private funding, or they have to have long-term care insurance. Mm-hmm. Unless they spend 24 hours, 24, 48 hours. No, I'm sorry. It's a 3-night stay in a hospital for whatever reason, a 3-night stay. And then after that, Medicare resets. And I'm telling you, again and again and again and again, the same people were going back to the hospital
and back to the nursing home.
To spend 3 nights for an upper respiratory infection or something like that, just so Medicare will keep on paying those bills. And when I brought attention to that, I went to the administrator. I said, "This just doesn't seem right," because I was just in Mrs. Smith's room yesterday, and now she's hospitalized for an upper respiratory infection. I didn't see that in my notes yesterday, and I visited these residents every single day. That was my job, Wow. Of course, I wasn't a medical professional. I wasn't a nurse, and I was very, very quickly told that, But so I kind of put that on in the back of my mind, and I wanted to start digging into more things that I saw red flags with, such as residents who were doped up on seizure medication, who didn't need to be doped up on seizure medication, just to keep, just kind of keep them under control or whatever. And every now and then the nurse would say, well, he's got behavior issues. Well, I didn't see any behavior issues, and it's my job to report that, So I brought to the administrator a lot of these red flags that were going on. And immediately she started to, I guess what you call blackballing or whatever, she started to immediately, write me up for little tiny things,
infractions,
and so on and so forth.
Yes.
So she couldn't find anything to fire me for. So she had 3 different auditors out of all, that didn't work there. They worked for the company. 3 different auditors to come in and audit my notes. None of them saw anything wrong with my notes. I did great notes, okay? And so then she started to harass me and so on and so forth. Well, long story short, the day that because I was also the marketing director, and the day that I won Marketing Director of the Year for the second year in a row,
you were fired.
I was fired.
You were fired. Hey, listen, no good deed goes unpunished in Louisiana, Scott. Remember that.
This was in Arkansas.
Oh, Arkansas. Oh, wow. Okay.
I guess my point is that Carol, this goes way beyond anything you could ever imagine. This is a $1 billion company, okay, or a $1 billion industry, okay, and if you stop sending these residents to the hospital every 100 days or whatever, and Medicare stops paying on them, well, then you start losing residents. You start losing residents. You stop losing people to shove medications into. Yeah. You stop shoving these medications into people. Then the pharmaceutical people are going to start getting ticked off at you, and then you start losing funding. So it's all about money and greed, and it makes me sick. Okay. After I was fired, I went to 4 different other nursing homes and applied around Central Arkansas. Applied for the social director's position. None of them would touch me.
Of course not. You probably were blackballed. I hate to say it, but you were probably blackballed. Yeah.
Oh, of course I know.
You just had to stop being honest, Scott. That's all there is to it. Thanks for the call, my friend. Thank you, Dan. We didn't even want to get into that. We were just doing the fiscal part of it. We have another call coming in. Norman, go ahead. You're on the Ross Report. Welcome.
This is Carol. Yeah. I have 2 experiences with nursing home. First of all, my youngest uncle, born early in the last century, was certifiedly mentally ill. He was in state custody for a long time. Then finally they sent him home. Well, he had his sister and his brother and so on. Eventually things got so bad he had to be put in a nursing home. Mm-hmm. Well, eventually they both died. Mm-mm. He could have come home, but no, he could not. So that's my view about. Now that I'm listening, what I'm hearing now is what I'm finding out. Then, at the turn of this century, my wife broke a leg in another state. She was in the hospital. Mm-hmm. Oh, can't stay there too long. They put her in a nursing home next door. Well, her employer would not pay for her to be in the rehab section. They put her in the old Alzheimer's section.
Yeah, that's the favorite thing to do. Go into a skilled nursing care.
Anyway, so there she was. I was with her. The lady we were put in the room, she was happy because she had company. But then she realized we're in there for the long haul. She was not happy. In the meantime, the little string to call for help, we getting ready to fall asleep. The staff would put it where the lady couldn't reach it.
Oh, no, that's really wicked.
Well, I'm awake, and I pulled on it. We were non-grata.
Non-grata. They couldn't wait to get you out of there, Norman.
Oh, man, eventually we were able to evacuate, and it wasn't a moment too soon.
All right,
the only thing, I'm so sorry for the victim, you know what I'm saying?
Yes, of course.
But that's the way it goes in life,
Thank you, Norman. Appreciate the call.
All right, okay, bye.
All right, Dan, getting back to this, all of this. In that committee, 6 senators voted to kill the bill, the Democrat and Republican. I mean, right across the board.
Right.
Jay Luno, Regina Barrow, Norby Chabert, he's Republican. Yvette Colomb, Democrat. Dale Erdy, Republican. Gerald Boudreaux from here in Lafayette, Democrat. Yeah. And, of course, the chairman of the committee, who did not have to vote, was Fred Mills. And, of course, throwing out all these scare tactics. Now, I went back in the archives, and I researched an article that Rebecca Ellen had written back in April of 2017. And it was all about this because there was a photo of Jindal and John Bel Edwards sort of in a transition photo talking about these things. Well, one of the things was the highlights of the article was Bobby Jindal's administration pursued healthcare reform for 2 years, estimated to save $77 million, abandoned it after the nursing home industry leaders sent an email opposing it. While running for office, John Bel Edwards told AARP intended to pursue the same home health reform plan, but now he has serious concerns. Nursing home leaders have donated millions. You want to hear the list? Oh my goodness. Yeah, well, it goes on and on and on. I'm trying to get it back up. I just lost it. It's coming. It's coming. Just when you want it. But I mean, it goes way back. Blanco.
Sure.
And the Nursing Home Association President Ronnie Gu, through family and businesses, he donated about $142,000 himself to Edwards' gubernatorial campaign. Nursing home leaders have donated, just an incredible amount of money. And it goes all across the board. I mean, you're talking about, all the way back to Blanco, Ilario, Darden, all of these people. They all got good money. And it continues today.
Well, it shows how profitable the industry is and what a gravy train they're sitting on. It's just they're going to do whatever they have to do financially to maintain their gravy train, and whoever will work with them. And how hard is it to get a politician running for office to take a campaign donation? And so they're spreading the wealth, that's for sure. Well,
it's really sad because now Bacala is talking about pulling his bill from the House. I think he should go forward with it. I think
put people on the record. Absolutely.
Exactly. Why back off now?
No.
Right.
Yeah.
This is the worst example of a good old boy system where cash is king, and it's really look. Jindal $1 million, John Bel Edwards $720,000, David Vitter $297,000, John Ilario $220,000, Buddy Caldwell $186,000, Sherry Smith Creek, Scott Angel, Jay Darden. I mean, Kathleen Blanco, Greg Tarr, everybody.
Right.
Everybody.
Down the line. And there's a handful of lawmakers who've stood up to the lobby. Conrad Apple, he's certainly been a hero in this, and there have been a few others, but they've got their friends, and they're locked in. There's no doubt about it.
It's an industry, as Hugh Eli, a retired 20-year administrator of the Louisiana Department of Health, he said this is an industry that's almost totally taxpayer-funded. The vast majority of the income is from taxpayers through Medicaid and Medicare. So even if you don't have a family member or a friend or anything, you have no influence, no whatever, you're paying for it.
That's true. Well, Carol, government's so big now. It's such a big, gigantic, bloated behemoth, and everybody wants a piece. Everybody wants their share. The nursing home people, credit them. They're organized. They know how to work the system. They work it well. They spread their money around, and they get tax dollars in return. I understand that. That happens with a lot of industries. But what bothers me is they're robbing seniors of the dignity of living their final days in their home where they want to be at a less expense than in a nursing home.
Exactly.
That, to me, separates this issue from all the other government waste scandals out there.
And how long are the people of Louisiana going to put up with this? Dan, you did a great article. Thank you so much for your time. We're hitting up a hard break here. We got to go,
right,
but
Carol.
we'll keep in touch. We're going to keep trying to get this thing done. This is a scandal of the worst order. Thank you, Dan.
Yeah.
Thanks for your time.
Thank you, Carol.
Take care. All right.
Pleasure.
Bye-bye.